Today, I'm going to talk about how to treat thoracic disc disease and when to have surgery. For thoracic disc disease, the treatment method is not well known. So people often misunderstand that things will get better with the physical therapy or exercise like cervical or lumbar spine. But the anatomy of the thoracic spine is completely different from the cervical or lumbar spine, so that it should also be treated in a different way. First, the thoracic spine does not have as much fluid as the cervical or lumbar spine. It's a stiff disc. If the discs are soft and moisture, they tend to absorb easily when herniated. For cervical or lumbar spine, there are cases that it gets better by about 70 to 80% through monitoring, doing physical therapy or exercising. Thoracic disc problems don't follow the same pattern. So, injection therapy or physical therapy is recommended to treat inflammation caused by disc herniation in the beginning. However, if you still feel pain or discomfort after 3 months, causal treatment needs to be considered. Most discs are said to be somewhat soft when they first form. As it is not hard, it can be treated 100% with an endoscope. But I've met many patients and they said that they went to other hospitals and heard that the thoracic spine cannot be treated with an endoscope. Patients often ask me, is it not possible to perform thoracic endoscopy? Actually, these are not entirely wrong. In endoscopic trained center, thoracic endoscopy training is called the highest level of difficulty. So there are only few doctors who can safely perform endoscopic procedures and can even teach other doctors in the world. I am so grateful to be recognized one of them. At Wooridul Spine Hospital, the treatment of thoracic disc has been actively studied for a long time. We've also developed a lot of treatments. Wooridul Spine Hospital developed a thoracic spine-only endoscope with a company in Germany and hold a patent for that. Having a lot of experience and sufficient supportive equipment, we say that we can treat thoracic disc disease with confidence. However, it is a bit different for herniated thoracic disc which have been too long. About 6 to 12 months after the disc herniations, they become hard. These calcified discs are called hard disc herniation. Partially calcified discs can be solved by carefully grinding them with a laser or endoscopic diamond drills. However, the problem is hardened discs, similar to ossification of posterior longitudinal ligament. That's the problem. In this case, surgical treatment is inevitably required. The reason why the thoracic spine is much more complicated than the cervical or lumbar spine in treatment is that the heart and lungs are in front of the thoracic spine. The thoracic vertebrae themselves are hard and have less space in the spinal canal for the nerves. It means the range of safe surgery is greatly reduced. For lumbar spine surgery, it is possible to pull the nerves little by little during surgery. We can pull the nerves like this when the disc is here and can remove the herniated disc. The surgical difficulty is not that high, so the surgery is done safely most of the time. The nerves in the thoracic spine cause paralysis the moment they are pulled, so the nerves shouldn't be pulled during surgery and it is very difficult. That's why surgical methods have developed in various ways. I wrote a book about the most challenging thoracic disc, which is highly regarded by the spine surgery community, last year. I mentioned about 10 different surgery methods. For thoracic disc herniation, a lot of things should be considered depending on the location, type, and the patient's symptoms. Whether the patient is paralyzed, whether the disc is severely herniated, or it becomes hard, all of these factors should be considered to treat accordingly, such as determining the direction of surgical access of the anterior, posterior, or posterolateral sides. It is true that thoracic disc disease is very difficult and complicated to treat. That's why many patients are unable to get treatment or often give up the treatment because they're afraid they might not be able to walk when it's wrong. However, it's not something you just give up. At Wooridul Spine Hospital, safe treatment is possible based on abundant experience. If you have thoracic disc disease, you can visit Wooridul Spine Hospital to get the treatment and lead a healthy life.